meet my dog? Come here, how about? Come on. Come on. Come on. Oh, look at that good dog. Look at that face. It's Lori. Go entertain yourself on YouTube. So, I have exciting news. It's Friday the 13th, so it only makes sense that they would call me with a diagnosis today. So, I heard from Cleveland Clinic in an email. I wish I was joking about that. And what she said was, if you have additional symptoms, they are consistent with Still's disease. So it's adult onset Still's disease. That's what I have. And so rather than cry and freak out, I'm going to try to limp toward the program, the plan. And here's how I do that. Okay, my husband says, oh, you're crazy because you Google and freak out, and that's because then I have covered the bridge. I have crossed the bridge of what it could be and the emotionality of that whole thing already days ago. So I just finished a video about what it wasn't. So now I'm gonna get to tell you what it is. And so adult onset Still's disease. My understanding of that disease, such as it is, because I haven't done a whole lot of research, I've read a few case studies, is that there are two types. One seems to attack your joints, and that one seems to be a little less difficult to manage and a little less ultimately involved and difficult on your system. They treat both types the same way. We'll get to that in a minute. The other is systemic, and that means that it tends to crop up with high fever, and it can involve issues related to your kidneys and liver and organs, and it's systemic. It is involved in your whole system. So, of my symptoms that have been here along the way, the only joint pain that I have complained about was when I was in the ER one of those nights. I think it was the very first one on the 14th. My right wrist was really it hurt to move it. It was very tight, and my hands are really swelled still. I cannot get my rings back on. So I've been off the steroid now for 4 days, and for the last 2 days of that 4 days, I've had a rash on my back, which is gone. You can kind of see where it was, but without the use of steroid, that stuff lingers longer. And then I got some on my face last night, so that's super fun. And yesterday's fever was like 99.5, and then today when I was at the doctor's office to get a refill of the prednisone, so happy about it, that was 100.5 while I was there at 1 o'clock. So that is what it is. 1/3 of people get one flare of adult onset Still's disease, and they go on a medication for it, and it clears up and it never comes back. 1/3 of people have intermittent symptoms, which means that every 6 months or a year they have a flare up and they treat it and it goes away. And 1/3 of people have a chronic illness. Some of the case studies of Still's disease shows that people have, in some cases, been in the hospital for 90 days with a daily fever and rashes and a terrible sore throat. That's another one. And another one of the criteria is a really high ferritin count, which I have. So that's where she got her diagnosis from. I asked the question of my doctor at Cleveland, is it necessary to go through a bone marrow biopsy to confirm? And she said no, because the only time we would go that route is if you have a complication. There are two specific diseases that can crop up as a result of Still's disease that seem to both involve your organs. One is called HLH, and the other is called MAS, which is macrophage activation syndrome, and it's where your body is super attacking itself. And so she said, should either of those things crop up, we would probably want to do a bone marrow biopsy. But otherwise, she said, If you do a biopsy and it's positive, you already knew you think you have it and you're treating it anyway, so why go through that? If you get it back and it's negative, that doesn't mean that you don't have Still's disease. It only means that they didn't find it in your bone marrow. She said it can be a little needle in a haystack kind of a thing. So when I spoke to her, I wanted to know about that. So she's putting me back on prednisone. The drugs that they use for this disease are similar to chemotherapy drugs in that they attack a certain kind of cytokine in your blood called interleukin 1. Okay, so those are the approved drugs for Still's disease. Anakinra, A-N-A-K-I-N-R-A, or the other one is called, oh shit, why I can't remember it. Elisa, I think it's Elisa, I-L-I-S-A something. Anyway, I'll look it up. I'll tell you in the next video. But the choice between those two is anakinra is very effective at, it's an immunosuppressant drug. That means it suppresses your immune system and makes it difficult for your body to overreact to itself and cause damage to either your joints or your organs. Anakinra is a daily injection that you give yourself. What the hell? I'm having so much fun. Okay. The other option that I can't remember the damn name of is Elisa? I don't know. Anyway, that drug is an injection every 4 to 8 weeks. It does the same thing. It attacks interleukin 1. That is the only approved drug. And the reason I bring that up is interleukin 6, which is another cytokine in your blood that's attacking your own system, and interleukin 18. Those two are also found in case studies of people with Still's disease. So that means the good news is, the bad news is there's only a couple of drugs that they treat this with. The good news is that the fact that there are other markers in your blood that seem to show up means they have somewhere to go for future treatment. They can find other drugs to create. These drugs are called biologics. They are man-made drugs, and they are very effective. They are very expensive. So when talking to Cleveland Clinic, she said, what we're going to do is put you on prednisone for now, 20 milligrams a day, to keep this thing at bay. And that's fine with me. I'm fine with that. And then it'll take about a month, but your insurance should hopefully approve these drugs. Now, the interesting thing about the one where you stab yourself every day, it's infinitely less expensive, but you have to use more of it because you have to do it every day. The other one, she said, is much less frequent and people prefer it. They still have to stab themselves, but only once every 8 weeks, maybe 4 weeks if it's not effective. But she said in my case, it would probably be very effective. We hope. And that there should be very little possibility of like other drug interaction or negative side effects of these drugs. The drawback to doing the one where you take a higher dose once in every little while is that if you do have an adverse reaction to it, it takes a long time for it to clear your system. If you take a shot that's supposed to last you 8 weeks, you're in for it for 8 weeks while you wait. So I told her to go ahead and try to get the approval for the more expensive drug because I never have given myself a shot in my whole life, so I'm not looking forward to that at all. But the other good news, is she looked at my labs and she feels like that I'm probably good to go to drink alcohol again, which I know shouldn't matter, but it does. I'm ready for a drink. It's been like 40 days. I've been stressy about this and I'm ready for a beverage. So there it is. You got yourself a diagnosis, y'all. So I will keep making videos though, because I think that there aren't enough out there. I would say that I'm trying to bridge a gap. There's either case studies that are so detailed that you like fall asleep reading them, or there are people who are in complete hysteria because they have found out they have something and they don't know enough about it. And I am a reader and a worrier, so I will keep reading for you and give you the info that I find out. So thanks for tuning in. Stay healthy. I'll see you next time.